Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you for joining us. Today's office hours is on premium tax credits. I'm Ayesat Odiale, the Health Projects Assistant at the Center on Budget and Policy Priorities. I'll be moderating today's session. Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the ACA health insurance marketplaces and Medicaid. The Center is a nonprofit policy organization, and we are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This session is not intended for press purposes, but we are not able to offer continuing education credit for our webinars at this time. Webinar logistics. Automated captions have been enabled for this webinar. To view them, you can click on the More option with the three dots at the bottom of your screen or the CC option at the bottom of your screen. All participants are muted and in listen-only mode, but you can ask a question, and you can do this by clicking on the Q&A icon at the bottom of your webinar screen and type your question into the box. Throughout the webinar, you can upvote questions in the Q&A chat. To do this, you click the thumbs up icon under a question you like. This will bring the question to the top of the Q&A chat. We will be monitoring questions and dedicate the majority of the time to a Q&A session. And we may not be able to answer every question asked today, but we will do our best to get back to you after the webinar. And we'll have a record of all your questions, which we'll use as a guide for future resources and presentations. And of course, you can also email your questions after the webinar to beyondthebasics@cbpp.org. Webinar schedule. Oh, and reminder that you will not be able to click on your screen to any of the links shared in the deck, but I will put a link to the deck in the chat where you can find all of the active links. The webinar schedule, here you can see the schedule of the webinars in our fall series. As previously announced, we'll be hosting a combination of traditional webinars as well as these new office hour sessions. For some topics, not a lot has changed since last year, so we're offering office hours to give you a quick refresher and answer your questions. But you can always refer to our webinar archive for in-depth webinars on these topics, including households and income, the premium tax credit, plan design and plan comparison, and the annual re-enrollment process for the marketplace. We're offering full-length webinars on topics where there is new information to share, or where we typically get a lot of questions. That includes eligibility, outreach, and application issues for people who are immigrants, which is split into 2 webinars like last year. We also have resolving data matching issues, and we are introducing 2 new webinars. What's new for 2025, which is delivered in both English and Spanish. And finally, for the first time, we will be hosting an enrollment trivia challenge to round out the series. A quiz show for both new and seasoned assisters to put your eligibility and enrollment skills to the test. Today's agenda includes around a 15-minute crash course on PTCs, followed by a live Q&A session. We've queued up frequently asked questions, and as I mentioned, we'll also take questions via the Q&A feature. Today's presenter is Jenny Sullivan, Director of Health Coverage Access from the CBPP Health Team. And we are joined by Lynn Cowles, Health and Food Justice Programs Manager at Every Texan and former Navigator Program Manager. She'll be helping monitor and answer your questions. Now I will turn it over to Jenny to get us started.
Great. Thank you so much, Ayesat, and thank you to everybody for taking time to be with us this afternoon. After our first office hours session last week, I can confidently say that we will not be able to answer all of your questions that will come in today live, but I'm also really happy to report that we were able to get through and send answers to everybody who asked questions last week. I hope that we can do that again. That's absolutely what we aspire to, but just know that if your question doesn't get addressed in the next hour, we're going to do everything we can to get you the right answer as soon as we can. Okay, so today I will be talking about premium tax credit eligibility requirements, how the PTC is calculated, and a little bit about how it's reconciled. Also, a note that I'll typically refer to premium tax credits as PTCs. I'll try to say that slowly, but sometimes it slurs together. But sometimes I'm also going to use the acronym APTC, which stands for Advanced Premium Tax Credit, which is how most people take the credit. They take it in advance to help cover a portion of their monthly premiums for marketplace coverage. Now, the two terms are technically not completely interchangeable, but they both refer to the financial help that people receive to make marketplace coverage more affordable. So just use that as your sort of shorthand. They're essentially the same thing. Okay, so there are three main eligibility requirements for the PTC. First, a person's household income has to be above the poverty line. There are a few exceptions, which we'll talk about. And there used to be a cap at 400% of federal poverty, but that has been temporarily eliminated. Right now, anyone whose premiums for the benchmark plan in their area would exceed 8.5% of household income can qualify for a premium tax credit if they meet other eligibility criteria. Second, a person must have an eligible federal tax filing status. They have to file single, or if they're married, they have to file married filing jointly. They also can't themselves be a tax dependent. If they are, then the person who claims them as a dependent is the person who would claim the premium tax credit for them. Again, there's always a few exceptions, which we will talk about. Then finally, the third requirement is that a person must be ineligible for other forms of coverage, which the working acronym here is Minimum Essential Coverage, or MEC. In addition, to enroll in a marketplace plan, even without a premium tax credit, a person has to be a U.S. citizen or have lawfully present immigration status. And my colleagues will get much deeper into eligibility for people who are immigrants at our webinar next Tuesday. Please don't miss that. It's a really important one, and there are some big changes coming, good changes. And people also cannot be incarcerated unless they're incarcerated pending disposition of charges, and people have to live in the service area where they buy their marketplace plan. Okay, so let's talk about the first bucket there, income requirements. I said earlier that the requirement is that the household income be above the poverty line, but there is an exception for people who are lawfully present immigrants if they are not eligible for Medicaid because of their immigration status, often because the state has a residency requirement before it will cover lawfully present immigrants in Medicaid. Now, the requirements vary by state, but if the person doesn't meet those requirements but does have a lawfully present status, then they can qualify for premium tax credits, even if their household income is below the poverty line. Additionally, there's another exception that comes into play at tax filing time. If someone projected their income to be above the poverty line when they applied for marketplace coverage, they took the credit in advance, but then they were ultimately found to have income below the poverty line when they come back to reconcile the credit, they're still eligible for the PTC. They do not have to repay the credit. This safe harbor is really important. It helps prevent the lowest income people from having to repay the APTCs if their income goes down. We don't want to punish people for that. And you can see in the table here just an example of income for households of different sizes and what that equates to in terms of the percentage of the poverty level for 2024. And this is just to give you a ballpark sense. Like I said before, some people with income over 4 times the federal poverty level will qualify for a PTC. And then we go up to a household size of 5 here, but household size is irrelevant. It can be as big as the person's household size is. Finally, remember that eligibility for premium tax credits is based on the federal poverty guidelines in place at the start of the open enrollment period. So the 2024 federal poverty guidelines are the ones that will be used to determine eligibility for PTCs for the entire 2025 coverage year. Okay, let's move to the second requirement for PTC eligibility, having an eligible tax filing status. To meet this requirement, you can be a single tax filer, You can be married filing jointly, or you can be head of household. If a person's status is married filing separately, they are not eligible for a PTC. There are no exceptions there. A person also can't be a dependent of another taxpayer, as I mentioned earlier. In that case, the person who claims them as a dependent is the one who has to claim the PTC for the person. The exceptions to the tax filing status requirements are this. You can be married, but filing as head of household, and the head of household exception is built right into the questions on healthcare.gov. So you won't even have the option to select that as a filing status unless you've answered questions suggesting that this is indeed the person actually meets these criteria. This is generally somebody who is unmarried or considered unmarried for tax purposes and pays more than half of the costs of keeping up the home for a qualifying person that they claim as a dependent. As we mentioned last week, a person can also be a survivor of domestic abuse or an abandoned spouse, meaning the person can't locate their spouse after making a reasonable attempt to find them. And people in these situations can technically remain married to their spouse and might be married filing separately, but they can legitimately select single as their filing status when they're applying for premium tax credits. And the help text on that page in healthcare.gov does specify this for people just to give people a little bit more comfort if they are concerned about saying that they're filing single when in fact maybe that's not what they're doing. Keep in mind that these marketplace exceptions do not require additional verification. There's no documentation required of people that claim these to verify that people are eligible to claim these exceptions. These are just things that you should know if you're helping somebody and that people would indicate when they go to reconcile their taxes as well. And the screenshot here is from healthcare.gov, but these exceptions are true in every state. Okay, on to the third requirement for the PTC, being ineligible for other forms of minimum essential coverage. There are a few types of minimum essential coverage that would bar somebody from getting premium tax credits if they are even eligible for the form of coverage, even if they are not enrolled. And that includes most government-sponsored coverage, like Medicare, Medicaid, and the Children's Health Insurance Program, as well as employer-sponsored coverage that is affordable and meets the minimum value standard. Now, there are also some types of minimum essential coverage that only disqualify somebody from PTC eligibility if the person is actually enrolled in them. Those include COBRA, employer-sponsored retiree coverage, certain veterans and TRICARE coverage, and Medicare if the person is required to pay a premium for Medicare Part A. Let's dig in a little more on employer-sponsored insurance. So a person's employer coverage has to meet 3 requirements. So these are a nested 3 requirements under those 3 requirements for PTC eligibility. So if the employer coverage meets these 3 requirements, then it is considered eligible coverage. If it doesn't, then the person could qualify for premium tax credits. Those requirements are that the offer must be an eligible plan, meaning it can't be indemnity or accident coverage. It has to be a full health insurance plan. Second, it must be affordable, meaning it must cost less than a certain percentage of household income, and that percentage is indexed and changes every year. For 2025, the percentage is 9.02% of household income. Last year for 2024, it was 8.39%. So if you have 8.39% in your head and that's a familiar figure for you, the new version of that for 2025 is 9.02%. Coverage is considered affordable for the employee if the employee contribution for self-only coverage is up to 9.02% of household income. If their premiums for self-only employer coverage are over that threshold, then the offer is considered unaffordable and the employee can qualify for a premium tax credit, assuming they meet other eligibility criteria. Then there's a separate test for people who are the spouse or dependents of an employee with an offer of employer coverage. An offer is considered affordable for these people, the spouse and the dependents, if the employee contribution for family coverage that covers the employee, the spouse, and the dependents, everyone in the household, is, up to 9.02% of income. So same threshold, but we're talking about an offer that would cover all of those people. If the premiums exceed that threshold, then the spouse and dependents would not be considered to have an affordable offer of employer coverage, and they could qualify for the premium tax credit. And this is true even if the employee themselves does not. So even if they have to get their coverage through their employer or not get a premium tax credit, sometimes you have families where eligibility for the PTC is split because of the employer coverage offer. When a household does have a member who has an offer of affordable employer coverage and then other family members who don't, then the family has choices. And these are important to walk through if you are helping somebody who's in this situation. Everybody in the family could choose to enroll in the employer plan despite the higher cost. They could split their coverage between the employer plan for the person who can't get PTCs and the marketplace coverage for those who can. Or the whole family could enroll in marketplace coverage, and the one member who isn't eligible for premium tax credits would pay the full cost of premiums. And the solution that's going to make the most sense for the family is going to be entirely individual, and there's going to be a lot of financial information that you're going to want to pull together to help them make that informed decision. So the last thing about employer-sponsored coverage is that the offer has to be considered, and I skipped forward, sorry about that, has to be considered comprehensive, meaning it must have an actuarial value of at least 60%. And most offers do meet this requirement, but if you are unsure, you can always confirm by checking the summary of benefits and coverage for the plan, if you have enough information to track that down. Okay, now let's talk about what kinds of offers of coverage disqualify somebody from being able to get premium tax credits. We've already covered the first one. Someone has an offer of employer coverage that meets minimum value and affordability requirements, and the person can't get a PTC, even if they don't actually enroll in the employer coverage or they miss the open enrollment period. And it's worth noting that if the employer has a waiting period before employees can qualify for employer coverage, for example, they have to have been on the job for 90 days, then people in that situation can get a premium tax credit, but just during those months. Once they become eligible for the employer coverage, they're no longer eligible for a PTC. As I mentioned before, other forms of coverage only disqualify somebody from a PTC if they actually enroll. If they have an offer and they don't enroll, they're not considered to have minimum essential coverage and they can get a PTC. These include employer coverage that doesn't meet affordability and minimum value standards, COBRA coverage, retiree coverage, and student health plans. So here we have a few more rules about how other forms of overlapping coverage affect PTC eligibility. And these are generally applied at tax time when a person reconciles their APTC, but they're good to keep in mind up front. So the first day rule, people eligible for premium tax credits on the first day of the month are considered eligible for the full month. Even if they have a change in circumstances, like they become eligible for employer coverage mid-month, they're still eligible for PTCs for the duration of the month. When it comes to Medicaid, if a person is receiving APTC but later becomes eligible for Medicaid, the PTC is allowed for months of retroactive Medicaid coverage, up to 90 days typically, and a person can choose to remain in the marketplace with PTCs for the entire calendar year, or they can enroll in Medicaid. They cannot simultaneously keep both, and when they go to renew their coverage, they cannot stay they cannot continue to get a premium tax credit for marketplace coverage at that point. But when it comes to those mid-year conversions, there is a little bit of an option there for people. Next, when it comes to Medicare, people lose PTC eligibility the first day of the month following the month they sign up for Medicare Part A. If the person doesn't enroll in premium-free Part A right away, then they're considered Medicare eligible as of the first day of the first full month after the person's initial enrollment period ends, and they lose PTC eligibility beginning on that day. But they will need to report this change. Otherwise, they could continue to receive APTCs and then owe money back at tax time. So it's important to touch base with people who are about to become eligible for Medicare to walk through what they're going to do when that day comes. Also, if the if the taxpayer informed the marketplace of their ESI premium, and despite having an affordable offer, the marketplace awarded a PTC to them anyway. Essentially, if the marketplace makes a mistake, then the taxpayer can still claim the PTC. But this safe harbor doesn't apply when a person re-enrolls. At that point, the presence of an affordable offer of employer coverage, it has to be updated, and they can't keep PTCs. Okay, so now I'm going to quickly break down how the PTC is calculated. So a premium tax credit is equal to the cost of the benchmark plan minus the person's expected premium contribution. The benchmark plan is the second lowest cost silver plan available to each member of the household. And the expected contribution is a percentage of the household's income that they are expected to contribute to their premiums, and it's on a sliding scale based on their income. The higher your income, the larger proportion of it that you're expected to contribute. Now, right now, people are receiving enhanced premium tax credits and have been for several years. The American Rescue Plan Act temporarily lowered premiums by reducing the expected contribution percentage for people of all incomes. And it also allows people with the lowest incomes to pay $0 in premiums for a benchmark plan. And it smooths the cliff where premium tax credits phase out by allowing people with income greater than 4 times the federal poverty level to get a PTC if they would pay more than 8.5% of their income for a benchmark plan. These enhancements were extended through the 2025 coverage year in the Inflation Reduction Act. And as a result of these laws, premiums are much lower right now for everyone, regardless of what state you live in and or whether you use healthcare.gov or a state-based marketplace. And these enhancements are largely credited with the record marketplace enrollment that we're seeing right now. 92% of marketplace enrollees qualify for PTCs. They're hugely important and impactful. So how much will a household pay in 2025? This is just a graph to show you how much higher the expected contribution percentages were before the enhancements took effect in blue. And then you can see that they've been lowered considerably by looking at the orange line. And I think probably most folks on this call are aware of this, but we don't yet know what will happen with the enhanced PTCs after the end of next year. Technically, they're due to expire, so if Congress does not take action, then we would revert to the percentages that you see there in blue. However, putting my advocacy hat on for just a moment, we are certainly working very hard to maintain these enhancements beyond 2025. And that is work that is very much happening now and expect will be ongoing until we need to stop, until we've either reached our goal or we've gotten to the end of 2025. And here is just a graph that shows, or I'm sorry, a table rather, where you can see what these numbers look like. People with income below 150% of poverty can get a benchmark plan for $0. Their premium tax credit is, of course, equal to the full cost of the premium for the second lowest cost silver plan. And I'm really skipping over a lot of details here. So as we did last week with our household and income office hours, strongly encourage you to listen to the recording of last year's premium tax credit webinar if you're newer to this content. But this is kind of the gist of things. The last thing I want to add is to keep in mind that expected contribution is not the same as a person's premium. There are a lot of other factors that go into determining what an individual is going to pay. It depends on the benchmark plan in their rating area, which is influenced by the person's age, their family size, and where they live. And then a person's premiums will also depend, excuse me, on the plan that they choose. And in certain states, they'll depend on whether the person uses tobacco. Certain states don't allow tobacco rating or set limits on it, but that varies by state. Okay. So the last thing I want to mention before we go to Q&A is repayment caps. So at tax time, people who ultimately have a higher income than they projected when they applied for the PTC or when they last updated their application will owe back some or all of the APTC that they received. You can see the repayment limits here for tax year 2024, and you'll notice that the limit for married or head of household tax filers is double the cap for single tax filers. And then note at the bottom, we have the repayment limit here for somebody with income over 400% of poverty, just to really put a fine point on it. Despite people being eligible in some cases for tax credits, if they have income over 400% of poverty, they are responsible for repaying the full difference of any PTC that they receive that they are ultimately not eligible for. There's no cap for those folks. And with that, I have gotten to the end of my overview, and I think we're ready to move to Q&A. So why don't we've got some teed up here from last year, so maybe I will answer a couple of these and then hand it over to my colleague Lynn to talk about some of the things that she is seeing in the chat while I take a beat and check in with the chat. So we get a lot of, these are all questions, by the way, literally questions pulled from previous webinars or from technical assistance that we've provided during the year. But if a person doesn't take premium tax credits in advance, can they claim it when they file their taxes? The answer is yes. Although most people choose to take at least a portion, and a lot of people take the full credit in advance, people who enroll in a qualified health plan and a marketplace plan can receive the PTC as part of their tax refund the following year if they're eligible for a larger credit than they received in advance. We also sometimes get asked if people enroll in a plan that doesn't use their whole credit. For example, maybe they choose a really low premium bronze plan. Can they get the rest of the credit back at tax time as part of their refund? That is not allowed. The credit can only be used toward premiums for an ACA marketplace plan. So if the person doesn't use the full credit, it evaporates. Excuse me. Let's take the next couple here too. So how do enrollees access the safe harbor at tax time if their income drops below 100% of poverty? So this is actually automatic. You can breathe a sigh of relief here. If a person was determined eligible to receive PTCs when they applied for coverage, but their income goes down during the year and their modified adjusted gross income is ultimately below 100% of poverty, they're automatically protected from having to pay back any APTCs received. But if you are helping somebody in this situation, it is important to make sure that they know about Medicaid coverage for themselves and any other family members that might be eligible. And that, of course, depends a lot on what state you live in and whether your state has expanded Medicaid. People won't be eligible to continue receiving APTC in future years if their income is below 100% when they apply, unless they have the immigration status sort of exception that disqualifies them from Medicaid coverage in their state. But again, for the sort of balance of the year, if they've been determined eligible for PTCs, then they don't have to stop getting them until it comes time to renew. I'm going to pause here and ask Lynn if there are any questions from the chat that we should queue up.
Thanks, Jenny. And thanks everybody who joined for these awesome questions. It's been really fun and kind of mind-bending to go through them. They're so specific and it's so clear how well y'all know the communities that you work with. So I do have one question for Rocky. I was about to start answering yours, and I just want to make sure that I know what ADAP stands for. So I don't know if you can unmute yourself or if you could just send another question, Rocky, but
and Lynn,
essentially,
it's the AIDS Drug Assistance Program.
Gotcha. Thank you. Okay, well then, yeah, we can answer that question about the AIDS Drug Assistance Program, about APTC. And specifically, like if somebody, I'll just put that I'll answer this question live. If somebody does have a need to have 0 APTC on their marketplace applications, but they do accept some, people can terminate future APTCs. So they can go into their marketplace application, or navigators or assisters can do that with them, and they can report a life change on that application and change the status of the application at the start so that that person is no longer looking for financial help. It's just like one of those very first pages of the application. So you'll still go through and you'll put, you know, what the household structure is, but you'll skip the income question on the application. You will have to still fill out the immigration status application. But as long as you report a life change on the application, you can remove those tax credits from the application throughout the year. They will still have those tax credits paid for previous months. So they'll have to reconcile those. So it'll be important for them to still file that 8962 with the marketplace. So Rocky, I hope that answered your question. And from here, there are a few more in the chat, which I can go through, or I can read through the page here. What do you think would be best?
Let's see. I think, well, I'm looking at the questions in the chat. I think we could do Ruth's live.
Okay,
I'm happy to take that one. So
sure.
Ruth has asked if someone has marketplace coverage in one state and whoops, and it just scrolled down. If someone has marketplace in one state and moves to another state, for example, from Florida to Ohio, and their income goes down to 0, they've lost their job, can they enroll in the new state's marketplace? Also, this person in this hypothetical does not have a lawfully present status in Ohio, meaning they wouldn't be eligible for Medicaid in Ohio, even though Ohio has expanded Medicaid, if I'm understanding this all correctly. Yes, when somebody moves, that triggers a special enrollment period. And so the person would be eligible to enroll in a plan in their new place of residence in Ohio. And because, as this hypothetical lays out, the person, despite having having no income or a very low income, because of their immigration status, they would be eligible for PTCs as well. Let's see, and this is very hard, folks. We are doing our best, but I'm trying to figure out where my eyes should go next. I'm going to go ahead and answer some of the other frequently asked questions on the slide here. And again, we'll just continue to kind of go back and forth. So the next one, we're on sort of the third bullet on this slide, which is if a marketplace enrollee later becomes eligible for Medicaid in the year, will they have to repay a PTC that they were awarded in the months before they became eligible for Medicaid? So it's related to the earlier question that I answered, but a person who has been determined eligible for PTC, but whose income drops during the year and they become eligible for Medicaid, they can keep the PTC for the duration of the coverage year, or they can enroll in Medicaid and drop the PTC and cancel their marketplace coverage. And you always want to make sure to do both, because in some instances, people are no longer eligible for a PTC, but they are technically still eligible for a marketplace plan. And we don't want somebody in the situation of being surprised with having to pay a full price premium for a marketplace plan that they previously received premium tax credits for. So always important to tackle both of those together. People can't keep both forms of coverage simultaneously. If they enroll in Medicaid and they're still getting PTCs, then they might get a periodic data matching notice from the marketplace that urges them to update their marketplace application and confirm, like, pick a side, you can't have both here. And then after a certain date, their PTCs would be terminated. And again, there are safeguards in place here, both to protect federal funds and ensure that PTCs are going to people who need them, and to ensure we're not penalizing people when they're in situations where they've lost income. We don't want people to have gaps in coverage when we can avoid that. There was another thing I wanted to mention here that we do get some questions about, which is a bit of an exception for people who are enrolled in marketplace coverage and become eligible for Medicaid during the year because they become pregnant. Medicaid eligibility thresholds for pregnant people are much higher typically than for non-pregnant adults. And people in this situation can choose to report their pregnancy to the marketplace and transition to Medicaid coverage. Or if they prefer to keep their marketplace coverage during their pregnancy, then they can simply choose not to report their pregnancy to the marketplace. And this is not nefarious. This is not lying. This is a choice that pregnant people have. Marketplace plans do have to cover pregnancy and childbirth, but the cost sharing and the premiums could certainly be significantly higher in the marketplace compared to Medicaid. And Medicaid also provides coverage to the birthing parent for 12 months following birth in most states, not all, and we're happy to check if you're curious what your state does. Now, when a marketplace enrollee gives birth, they would have to report the birth to the marketplace, both to get coverage for the newborn, either through the marketplace or through Medicaid or CHIP, but also to adjust their household size, which could affect or would affect their PTC amount. So little things to consider. Lynn, how are we doing on live Q&A?
Doing well on live Q&A. They are coming in quickly, which is really exciting. I'm going to answer Maria Jimenez's question, which is very similar to your previous response, Jenny, about Medicaid eligibility in the middle of the year. So this question is, if a consumer receives APTC and becomes eligible for Medicare in November of that year, and the income increases, do they have to repay? So that's a complicated question because it involves a couple of different programs and then also the income increase. So Maria, the first thing that that person should do is ensure that in the months leading up to November, they're checking their mail and making sure that when they get their notices from the Medicare office that they will become eligible for Medicare on their 65th birthday, or whichever birthday is coming up for some of those people in circumstances where it's not their 65th birthday. But if people do become eligible for Medicare, then Medicare, like Medicaid, prevents people from being eligible for tax credits. But also being eligible for Medicare Part A makes people ineligible for the marketplace, period. So unlike with Medicaid, in those very rare circumstances when people are eligible for Medicaid, but also purchase a full price plan on the marketplace, if people are eligible for Medicare Part A, they are disallowed from enrolling in even a full price plan in the marketplace. So that's the first part of your question, Maria. And then the second part is for the income increases, if that person who's now eligible for Medicare, if they did have an income increase in the year, then they can expect to repay APTC because their income during those months when they did receive APTC actually made them eligible for less PTC. Which I realize is a lot of acronyms, but since the income went up and the application income estimate was lower, then they will have to repay APTC because the actual earned income at the end of the year was higher than the estimate. So basically the IRS gave them too much financial help and they will have to repay the difference that attaches to their actual earned income at the end of the year. And I am in the middle of responding to Kathleen Thompson's question. Jenny, go ahead.
Perfect. Thank you all for humoring this. Your questions are really strong and I appreciate all of them. I wanted to first answer a clarifying question from Stephanie Garza. So to clarify, somebody can have both Medicaid and Marketplace active, but they wouldn't be eligible for premium tax credits. That's correct. It would rarely happen, right? Because at that point, they are not eligible for PTCs. So they are paying the full price of a marketplace plan. And if they are also eligible for Medicaid, they are by definition, they have limited income. And so the financial viability of that choice makes it a rare one. But technically, the prohibition is on having Medicaid and PTCs simultaneously, not Medicaid and marketplace coverage simultaneously. But feel free to ask more clarifying questions if that didn't quite do it. I had another one I marked in here. Let's see. From a person with the last name Nguyen, can you repeat the part about not taking the full PTC and it evaporating? I didn't quite get that. Sure. So this was just let me see if I can use some real numbers off the top of my head and make this make a little more sense. If somebody is eligible for $100 PTC every month and they choose a plan that costs $100 a month, then they're even Steven. By the end of the year, they don't owe any money back to the government and they don't get any money back. If the person enrolls in a plan that is $150 a month, then they put their $100 tax credit towards that, and they have to pay $50 every month out of pocket for their coverage. If the person is eligible for $100 a month, but then when they go to reconcile, it looks like their income has actually dropped and they weren't eligible for that entire credit. Maybe they were only eligible for $50 a month. Then they're going to owe $600 back to the federal government for the credit that they received that they weren't eligible for. But to put a really fine point on the question here, if somebody is eligible for a plan or for a premium tax credit that's $100 a month, and they choose a less expensive plan that only costs $50 a month, they do not get to collect $600 when they reconcile their taxes the next year. They don't get to keep any unused credit and put that money in their bank account. That money goes away. It's just unused tax credit, and that was their choice of whether to go with a less expensive plan or apply the full tax credit to a more expensive plan. And then there was one other one, let's see, that I had flagged to answer from Kenneth, who says, people with income under 138% of poverty are not eligible for PTCs in some states because they would be eligible for Medicaid, or here in California for Medi-Cal. And that's absolutely correct. Technically, the statute says, and the regulations talk about eligibility for PTC as being income at 100% of poverty or higher, but that's superseded by Medicaid coverage or Medicaid eligibility limits. So if your state has expanded to 138% of federal poverty level, then the credit kicks in above that income level and not for people with income between 100 and 138%. I'm going to go back to some of the questions on this slide now, and we'll just keep at this. Okay, let's see. So now we're on to the fourth one on this list, which is what's the repayment cap for people with income below 100% of federal poverty level. So the safe harbor protects people with income below 100% of poverty from having to repay APTCs. So people with income greater than 100% but less than 200% have the repayment cap of $375 for single taxpayers, but below 100% are folks with income below 100% are protected from having to pay back APTCs. The next question on the slide here is, let's see, oh yeah, with cost sharing reductions. So if somebody receives cost sharing reductions and they ultimately make more money than they projected on their application, do they have to reconcile cost sharing reductions? Technically, this webinar is on PTCs, but cost sharing reductions are of course available to lower the sort of out-of-pocket costs for a person with income below 250% of poverty. Unlike the premium tax credit, cost sharing reductions are they're not a tax credit. They're not something that you have to reconcile at tax time. So if a person has income at 250% of poverty or lower, then they're eligible for a cost sharing reduction if they enroll in a silver plan. You do have to enroll in a silver plan. If they don't, then they are stuck with the cost sharing in the plan that they choose, and they can't, at tax time somehow collect extra money for their out-of-pocket costs because they chose a plan that didn't come with cost sharing reductions. Likewise, if the marketplace determines that a person is eligible for cost sharing reductions and they do enroll in a silver plan, they are not responsible for repaying cost sharing reductions at tax time if their modified adjusted gross income ultimately exceeds the income limit for cost sharing reductions, although they would be responsible for paying APTCs if they owe some of those back. Lynn, questions? I'm sure you're in the middle of typing a really astute answer to somebody else, but anything you want to answer live?
Let's see. Yeah, I'll go down to the next question on this slide here. And Marvel, I'm answering your question, or Marvel, sorry, about Medicaid for visiting students. So I'll get to that. So let's see, what happens if a person is single and receiving APTCs, but gets married halfway through the year? And then second question, what about married people who divorce during the year? Actually, just like for that response that I gave to the person who was considering the AIDS drug assistance program, the report a life change button is a very good friend to assisters throughout the year. The report a life change button is the one that you'll use for reporting income increases, for reporting household changes. So this includes children who might be new to the household, or new spouses, or of course in the circumstance of divorce, former spouses. And we did talk about this in our last webinar also, but importantly, if people are not currently married, then they cannot use their plans to get married to indicate on the marketplace application that they are already married, even if they have a date set and they have cakes picked out and everything. And the same is true with divorce. If people do not have divorce papers signed, then they cannot claim that they are single on their marketplace application until they actually get that divorce. And that can be really, really tricky, because we have the open enrollment period coming up, and if somebody comes into the enrollment center or into your clinic and says, but I'm gonna get divorced and it's gonna happen, and it just hasn't happened yet, and I don't want my soon-to-be former spouse on my marketplace application, then you as a sisters just have to explain the situation and make sure that that person is clear that you do have to put their soon to be former spouse on the application until the divorce is final. But that's all a long way of saying on the application, when you're using healthcare.gov, on the left-hand side of the screen, it's about like 4 or 5 options down in the My Plans and Programs page. You select report a life change to do any of those household changes on the application. And then the next question here is, when determining employer coverage affordability, which plan do you use? Like, do you use the employee plus spouse option? Do you use the employee plus child option? Or do you use the entire family plan? For employer coverage affordability, there are a few pretty important things that really lead the helpful situation to be when people bring their employer coverage documents with them. So if they have an offer of health insurance from an employer, sometimes people will bring in the packet, right? The packet that has the maybe the copays and stuff listed. But what we really need to see are the employer breakdowns for which plans the employer actually offers, and then how much those plans cost. It's helpful to also to ask the employer in advance, for the person to ask the employer in advance whether those plans meet minimum essential coverage. It doesn't happen as much anymore, but there are still sometimes employers that will offer health plans that don't meet minimum essential coverage. And if the plans offered don't, then you don't have to worry about the employer coverage calculation because the plan doesn't meet the standards that would, or sorry, the minimum value standards that would allow them to be required to enroll in that plan or to pay for a full price marketplace plan. So, so there's that employer coverage affordability question. And then to answer this question very specifically, you use the employer family plan. So if somebody has a spouse and a child, then whatever the cost of the full family plan is, as long as it is the least expensive plan that does meet those minimum value standards, then if the cost of that is over the affordability standard for that year, then that family can enroll with APTCs. So now if a person has an employee and a spouse, but they don't have a child, then that person cannot use the cost of the family plan, right? So you can't just like imagine a new family member at the time that you're enrolling. You have to use the actual household structure and the employer figure that would match that actual household structure.
And can I add one more thing there, Lynn?
Yeah, of course.
I love that you can't invent an imaginary family member, right? Also, you might have people who are not technically part of the household, but who could qualify for that employer coverage. I'm thinking often of young adults, people up to age 26, but potentially who the taxpayer is not claiming as a dependent. So the cost of covering those people is not considered when you're trying to determine if, quote, the family has an offer of affordable coverage, even though that person could technically and probably will get coverage through the parent's employer coverage. And the cost of people who are offered coverage but aren't part of the household are not considered in determining whether the employee's family members have an offer of affordable coverage. So you just really have to go back to those household composition rules. And really, when we're talking about household, don't think about a traditional family or the people who live under one roof, because in this case, we're really talking about the tax relationships there to determine whether somebody can get coverage. And similarly, we're not worried about whether it, if that young adult wants to get premium tax credits, the fact that they could enroll in a parent's employer-sponsored coverage doesn't count because they're not part of their tax household. So they can choose between the employer coverage of the parent, or if they're eligible for PTCs, they could go that route. So there was a few questions in the chat that I had tagged I could answer. The first one from Amanda is, if someone missed their enrollment for their employer coverage, can they still apply for Marketplace until their employer enrollment opens again? If they were employed by the employer and they were eligible to enroll in an employer-sponsored plan and they didn't, whether they missed it or they looked at it and decided not to, or they didn't understand the rules, regardless, if they had it available to them and they didn't take that option, then they cannot enroll in Marketplace coverage at another time during the year. They have an offer available to them, and so they are not eligible for premium tax credits. They could enroll in Marketplace plan for a full cost, but they wouldn't be eligible for for a premium tax credit. They would have to wait until open enrollment or until the employer's open enrollment happens again. Next one from a question from Lynn. Is it true that a pregnant woman is counted as 2 people for household size? This is a really good question, and the answer is it depends when you're talking about Medicaid coverage. In Medicaid, states have the option to count when they're considering a pregnant person, they can count the pregnant person as 1 or as 2, or if the pregnant person is expecting to give birth to more than 1 child, then they could count the number of people the pregnant person is expected to give birth to. This depends entirely on how the state has designed their Medicaid rules. For marketplace purposes, the pregnant person counts as 1. They do not count for more people than that. So again, drilling back down on those household and income rules and how they are different between the marketplace and Medicaid. And then a sort of related question from Nona. Can you clarify when a person is pregnant, do they report that they're pregnant or do they report when they give birth? So when if a person is already enrolled in marketplace coverage and they become pregnant, they can choose whether to report that to the marketplace. And if they would be eligible for Medicaid coverage, then they would be transitioned to Medicaid coverage. Or they can choose not to report that to the marketplace. But if a person who is enrolled in marketplace coverage gives birth, then you do have to report that. Again, because you want the newborn to get routed to whatever form of coverage they are eligible for, and you want to change the household size so that the people who are getting marketplace coverage have their PTC adjusted for the larger household size. Let's see. Lynn, are you ready to answer some questions?
Yes, and I want to cover Eliza Rose's question from 1:30. So this has been happening a lot this year, but helpfully has been curtailed by the Centers for Medicare and Medicaid Services after a July 19th change in agent and broker access to consumer data. But Eliza Rose's question is, what if someone was fraudulently enrolled via marketplace utilizing tax credits? So that's like if an agent or a broker got birth date, social security, and name information for an individual or for multiple individuals from some data source, and then use those pieces of information to enroll that person in a marketplace plan without their knowledge. If somebody was enrolled in a marketplace plan without their knowledge due to agent or broker fraud, then they are not responsible for reconciling their tax credits. That said, there is still a process that they need to go to, and it can be really helpful for those folks to talk with navigators or certified application counselors or assisters in general to make sure that they know what to do, who to talk to, and how long the timeline can actually be in order for them to make sure that the IRS understands that they fraudulently received advanced premium tax credits, and it is the marketplace's responsibility to effectively wipe those tax credits from their history on healthcare.gov or with the health insurance marketplace. So what CMS has advised people to do in the past is either call the marketplace call center with the individual, or if you are a Navigator organization, use the CMS complex case form to report the fraud, and then the complex case center staff will contact the Navigator back, will review that case with the individual and with the Navigator, and will eventually, as long as all the T's get crossed and all the I's get dotted, as long as those folks, tick the boxes that they need to tick, then that individual who received those fraudulent tax credits will not have to reconcile them at the end of the year. The marketplace will essentially void the 1095-A that they would have sent to them if they were receiving those tax credits legitimately. That's complicated though, and thank you for that question, Eliza Rose. Another question here that's on the frequently asked questions screen is, how can I find the benchmark plan for my area? I'm sorry to make you unmute, Jenny. Did you already answer that question?
I didn't, so you can or I can.
Okay, gotcha. Yeah, so the benchmark plan for your area is always the second lowest cost silver plan. So there is that really helpful tool called the C Plans and Prices tool on healthcare.gov. If you haven't been there before, check it out. You can just put into a search engine healthcare.gov and then the words C Plans and Prices, and you input a consumer's zip code, you select their county, and you estimate using a very simple tool their income estimate for the year and household size, or you can also just, fill out the marketplace application for them if it's during open enrollment. And by filling out either the C plans and prices tool or the marketplace application, you can then filter to silver plans, and you can arrange those plans or sort them by cost. And that second lowest cost silver plan is always the benchmark plan. So that's a very user oriented description of how to find the benchmark plan. Jenny, is there a different way that you advocate for folks who are looking for those numbers in their area?
No, that's a great, I think that's the best first answer. And I did put a link in the chat. So the C plans and prices tool or sort of website is where you can find the plans for healthcare.gov. State-based marketplaces have their own equivalent of that. And we've got a tool in the chat where you can go and find the link if you don't already have it for your state. So you can see sort of how to find the plans and prices without actually filling out a marketplace plan. But the other thing I wanted to mention is that sometimes we get questions when an assister is helping somebody reconcile tax credits or deal with tax-related issues after the fact. And when you're doing that, you do need to cite sort of what was the benchmark plan available to this person for a given year. And there are two places you can find that. I will put these in the chat, but healthcare.gov has a tool for healthcare.gov states that goes back to 2021, and I will put that link in. And then the IRS also has a tool that you can use for any state going back to 2018. So again, this is if people are on the tax filing side of things and need help with filling out those forms and citing what the relevant benchmark plan was for a person. It can be hard if you're outside of the coverage year where you can, actually go to see plans and prices. If it's in the past, it's really hard to find those numbers otherwise. Lynn, I'll pass it back to you and I'll put those links in the chat that I just mentioned.
Great, thank you. And the last couple of questions here on these slides are, please explain interactions between PTC eligibility and COBRA. COBRA is usually very expensive, but it's not always very expensive because sometimes employers will opt to cover part of the continuation of benefits plans made possible by the Consolidated Omnibus Budget Reconciliation Act, which is what COBRA actually stands for. But so when people leave their employers, that employer, as long as they had a health insurance plan, that employer is required to offer them 18 months of COBRA. But the employer is no longer required to pay for that, to help that person pay for their health insurance anymore. So some employers will help former employees pay for their COBRA plans, maybe as part of a severance package, or maybe they just had a good relationship with that employee. But as soon as the COBRA plan becomes unaffordable, then by the employer affordability standard, which is, I don't want to say it wrong, but it was just over 9% from that first slide that Jenny shared, looking at the affordability standard for 2025. So once the COBRA plan, the full cost of it costs more than just over 9% of that individual's household income estimate for the year, then that opens up a special enrollment period where that person can then switch from COBRA over to the health insurance marketplace with premium tax credits. So it's all about affordability with COBRA. So if a COBRA plan remains affordable, remains under 9 point some percentage of a person's individual income estimate for the year, or their household income estimate for the year, excuse me, then they would stay on COBRA because that would be an affordable option for them until the open enrollment period took place. During open enrollment, people on COBRA can leave their COBRA plans and they can get on the marketplace unless they have a different offer from another employer, of course. But in general, COBRA, when it becomes unaffordable, people can open up a special enrollment period for themselves to get into a health insurance plan on the marketplace with the advanced premium tax credits. And then the second question, or the very last question here is, explain interactions between PTC eligibility and Medicare. And I think I did this already a little bit before, but just as a tiny refresher, if people are eligible for Medicare Part A, then they are not eligible even to enroll in the marketplace, whether it's with premium tax credits or without premium tax credits. So PTC eligibility effectively goes away when Medicare Part A eligibility opens up to people, including, and then also the marketplace eligibility in general dissolves with Medicare eligibility.
That's great. And I'm going to put a link to some slides we did last year. It's one of the last scenarios in the, the deck that I just popped in the chat that walks through sort of different considerations for Medicare and marketplace interactions if a person is enrolled automatically in Medicare when they turn 65, as compared to somebody who has to actively enroll in Medicare, because there are a few nuances there to keep in mind. Somehow we are already at 3 o'clock and the questions are still coming in. Like I just saw a new one pop in seconds ago. We're going to do our best to get back to you. If we haven't answered your question live, I commit to trying to get you an answer and to do it as quickly as possible. But at this point, we have to close out for the hour. So I'm going to pass it to Ayaset to do just that. But thank you all so much. And a huge thanks to Lynn for tag teaming with all of this and all of the fabulous responses you provided, both live and in the chat.
Yes, thank you, Jenny, and thank you, Lynn. Both of you put on kind of multiple hats today with answering live and also responding to folks in the chat. And thank you to the audience today for being so engaged. Here you can see our resources that we have, and as well as our next upcoming webinar is not in office hours, but it is an in-depth webinar on September 17th at 2 p.m. Eastern Time. We are going to jump into immigration-related eligibility for health coverage programs. You can register for that on our website. And if you have any questions, of course, you can contact Jenny or the general Beyond the Basics at cbpp.org email.